Hello everyone, I'm Anas Al-Ubaidi, and the topic for this session or this lecture is the documentation standards in outpatient settings within chapter 26, which is a chapter about review of family medicine and outpatient scribing within the Certified Medical Administrative Assistant Program by ACMSO. Introduction. Documentation standards in outpatient settings form the backbone of effective and efficient healthcare delivery in ambulatory environments. Outpatient settings, characterized by shorter patient encounters and a diverse range of clinical presentations, require scribes and healthcare providers to maintain meticulous and high quality documentation practices. Unlike inpatient environments, where providers have extended time frames for comprehensive care, outpatient care demands rapid, yet precise recording of patient information within constrained timelines. This balance is critical for enhancing patient outcomes, supporting care continuity, and ensuring compliance with legal and reimbursement requirements. Accurate documentation in outpatient settings goes beyond simply recording a patient's symptoms, or diagnosis. It serves multiple purposes, from safeguarding patient safety to enabling coordinated communication among multidisciplinary teams. As for instance, a concise yet comprehensive electronic health records (EHR) entry can facilitate seamless transitions of care by providing other healthcare professionals with clear insights into earlier treatments and interventions. High documentation standards also contribute to improved patient experiences, as complete records reduce the chances of repeated diagnostic tests or inconsistent treatment strategies. Outpatient care settings pose unique challenges in achieving and maintaining these standards. The volume and variety of patients, ranging from routine health screenings to chronic condition management, demand adaptability and efficiency in documentation. Additionally, scribes must be adept at capturing the specific requirements of diverse clinical specialties, from orthopedics to dermatology, while adhering to general documentation protocols. Time pressure is another significant factor. Scribes must work swiftly without compromising the quality or accuracy of the record. For instance, recording succinct yet detailed histories and orders for a new patient while simultaneously managing follow ups necessitates advanced skills in prioritization and attention to detail. Legal compliance is another pillar in outpatient documentation. Healthcare regulations such as HIPAA, the Health Insurance Portability and Accountability Act, and requirements from insurers necessitate the capturing of complete, verifiable, and confidential patient information. Errors or omissions in outpatient documentation can result in claim denials, audits, or even medical legal disputes. Adhering to documentation standards mitigates these risks, ensuring that notes are comprehensive and legally compliant. For example, detailed coding notations can directly impact revenue cycle management and reimbursement processes, making documentation integral to operational efficiencies within outpatient facilities. Furthermore, the role of outpatient documentation extends to fostering continuity of care. Many outpatient visits are part of long term treatment plans, requiring cross referencing with past medical histories to ensure consistent care delivery. Proper record keeping not only helps maintain a clear narrative of the patient's health over time, but also supports collaborative care across various specialists and providers. This is especially critical in patient populations with chronic diseases such as diabetes or asthma, where accurate and up to date documentation can directly influence clinical outcomes. The key points: Accuracy in outpatient documentation. Accuracy is the foundation of effective outpatient documentation. It ensures that patient information is recorded systematically and reflects the nuances of the clinical encounters. We'll start with capturing detailed patient histories. Importance here recording a thorough yet concise history of present illness, HPI, past medical history, and family history provides context for treatment decisions. As, for example, a patient presents with a sore throat, accurate documentation should include onset, associated symptoms, for example, fever, and modifying factors, for example, alleviated by warm drinks. Benefit here ensures that the provider can make informed decisions and facilitates precise follow-up care. Recording objective data, definition, collecting accurate measurements such as vital signs, diagnostic test results, and physical examination findings, as for example, recording temperature of 38.6 degrees Celsius and inflamed tonsils with white exudate for a patient with suspected strep or streptococcal infection throat. Relevance here leaves little room for subjective interpretation and supports diagnostic clarity. The medical measurements here, definition, example, and relevance. We have consistency in terminology and abbreviations. Advise here always use standardized terms and abbreviations to prevent ambiguities in medical records. As for example, instead of informed terms like headache, or use headache and document. And here the difference between two headache, HED, while use headache, HEAD, and document severity using a scale. Outcome here, uniformity ensures the health record can be easily understood by any healthcare professional accessing it. Avoiding errors and omissions. Tip here, double check all entries for completeness and possible inaccuracies, especially when noting medication doses or diagnostic results. Example, ensuring that penicillin allergy is prominently noted to prevent adverse reactions. Result here improves patient safety and avoids costly mistakes like misdiagnoses or inappropriate prescriptions. Medical record guidelines here, as here we have a summarized diagram summarizing the medical record guidelines, as we have advice, example, outcome from left to right. Adhering to legal compliance, your legal compliance is critical to guarding patient information, avoiding disputes, and ensuring seamless reimbursement processes. We'll start with the HIPAA standards. Guideline here upholds strict confidentiality in all patient records and communications. Example, avoid referencing personal identifiers in publicly visible notes to prevent breaches of privacy. Significance here protects the healthcare facility and Scribe from legal consequences while maintaining patient trust. And here HIPAA standards applies to USA. In USA healthcare system, they follow HIPAA and data privacy protection. Coding precision definition here maintain accurate ICD-10 or CPD coding for diagnoses, procedures, and treatments. Example, properly code a routine checkup with ZOO-00 to differentiate it from a condition-related visit. Impact, influencing billing and insurers process claims without delays. Medical legal documentation requirement here record every action, decision, and conversation pertinent to the patient encounter. Example, if a patient's medication was adjusted due to side effects, the scribe must include who recommended the change and the rationale. Importance here protects the provider and facility during audits or legal investigations. Supporting continuity of care. Outpatient documentation plays a pivotal role in long-term and coordinated patient care, bridging gaps across multiple clinical encounters. We have here comprehensive medical records. Definition here ensures that Ensure that patient records include details from all past visits for a complete picture of their health. Example, documenting diabetic monitoring data such as HbA1c trends over several visits. Benefit here guides providers in adjusting treatments based on past effectiveness or new developments. Facilitating multi-specialty collaboration tip here include notes summarizing referral results or interactions with other specialists. Example, incorporate findings from a cardiologist treating the patient's arrhythmia into the primary care notes. Outcome promotes integrated care among various healthcare providers. Patient-centered notice focus tailored documentation to emphasize patient goals and preferences. Example, patient managing hypertension may prioritize lifestyle adjustments over pharmacological interventions. Result enhances provider patient trust and adherence to prescribed care plans. Streamlining follow up records. Practice your record actionable follow up instructions and timelines. Example, return in 4 weeks for a reassessment of blood pressure medication efficacy. Effect prevents overlooked care steps and encourages proactive management of chronic conditions. Addressing challenges in diverse clinical contexts. Outpatient scribes often encounter patients with varying conditions and needs, requiring adaptability and robust documentation practices. We'll start with managing high patient volume problem. Rapid turnover in outpatient settings poses documentation speed challenges. Solution here: use templated EHR, electronic health record formats for common case types like upper respiratory infections or blood pressure checks. Example, pre-filling sections of records can save time for providers during patient encounters. Specialty-specific documentation requirement: adjust documentation to fit the scope of practice for each specialty. Example, an orthopedic clinic requires a precise recording of joint mobility tests or diagnostic imaging results, whereas dermatology records should focus on lesion descriptions and photographs. Outcome ensures scribes remain versatile and proficient in handling diverse clinical requirements. Addressing language and cultural barriers. Skill here: documenting effectively despite linguistic challenges or cultural sensitivities. Example, collaborating with interpreters to accurately capture non-English speaking patients' histories. Impact improves inclusivity and equitability patient care in outpatient environments. Adapting to telemedicine. Trend here: EHR, electronic health record documentation, for telehealth visits often requires unique protocols. Example, include descriptions like patient appears alert and oriented via video consultation. Benefit here: ensures thorough notes even in virtual care environments, aligning with billing guidelines. Summary tables. Here we have table on principles for accuracy in outpatient documentation. Principle description. Example, benefit risk if ignored. Principles: we have detailed patient histories, objective data recording, consistent terminology, preventing omissions, double checking entries. Table on legal compliance in outpatient documentation. Aspect description. Example, importance, consequences of non-compliance. Aspects: we have HIPAA standards, proper coding practices, documentation of consent, time and date stamping, record retention policies. Table ensuring continuity of care. Component description. Example, benefit, impact of missing information components. We have comprehensive medical records, summary of referrals, actionable follow-ups, patient-centered narratives, cross-provider communication. Table on challenges in outpatient documentation. Challenge description. Example, mitigation strategy. Risk without mitigation challenges. We have high patient volume, specialty-specific notes. Complexity of chronic conditions, telehealth documentation, EHR system issues. Here we have table on tools For optimizing outpatient documentation, tool description, example, benefit limitation tools, we have standardized EHR templates, speech recognition software, clinical decision support tools, medical coding assistive software, and digital audit trails. Next, we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. Why is accuracy crucial in outpatient documentation? A. It reduces the provider's workload significantly. B. It ensures detailed and precise records for better patient care and legal protection. C. It eliminates the need for patient follow-ups. Or D. It focuses solely on recording patient demographics. And the answer would be B, as it ensures detailed and precise records for better patient care and legal protection. As accuracy in documentation ensures that all critical patient information is recorded in detail, which not only supports informed clinical decisions but also offers legal protection against potential disputes. Question 2. Which of the following is an example of promoting continuity of care in outpatient settings? A. Documenting the family medical history in detail. B. Referring to and including the findings of a specialist in the patient's record. C. Reducing visit lengths for all patients to maximize case numbers. Or D. Use informal notes with minimal structure to save time. Definitely the answer is B. Referring to and including the findings of a specialist in the patient's record, as coordination across providers, including referrals and specialty input, ensures seamless continuity of care, allowing other healthcare professionals to make decisions based on comprehensive information. Question 3. Which regulatory standard ensures confidentiality in outpatient documentation? A. ICD-10 compliance. B. HIPAA standards. C. CPT procedural guidelines. Or D. Medical scribe national coding requirements. It is B, as it applies to USA, HIPAA standards, as HIPAA ensures that patient confidentiality and secure handling of personal health information are maintained throughout the documentation process, a key requirement for legal compliance. Question 4. What is the best approach for adapting documentation in a telehealth patient encounter? A. Focus on describing only physical symptoms that the provider can observe during the video consultation. B. Use telehealth specific documentation techniques, such as specifying visual observations and patient reported conditions. C. Ignore telehealth protocol differences and treat it as an in-person visit. Or D. Reduce the level of detail due to restrictions in virtual care. The answer is B. Use telehealth specific documentation techniques or protocols, such as specifying visual observations and patient-reported documents or conditions. As telehealth documentation must include both subjective and visual elements to capture the nuances of virtual care encounters, ensuring completeness and accuracy. Question 5. Why is comprehensive action-oriented follow-up documentation is important? Well, A, to reduce the overall length of outpatient notes. B, to create standardized notes that avoid patient-specific details. C, to provide clear instruction for next steps, ensuring patient compliance and preventing care gaps. Or D, to eliminate the need for input from other healthcare providers. The answer is C, as to provide clear instructions for next steps, ensuring patient compliance and preventing care gaps, as actionable follow-up notes are critical to guiding patients on their care plans, reducing complications, and avoiding unnecessary readmissions by addressing their health needs effectively. And here we come to the end of this lecture. Thank you very much, and goodbye.